Hey guys, welcome back to my YouTube channel. So the topic I'm going to be talking about today is one of the most exciting transitions you'll make as a medical student, and that's the transition from basic sciences to clinical sciences. So this is a very exciting and special time in the career of a medical student because step one is finally behind you. You have the burden of step one taken off of your shoulders. It's now in the past, and you can finally move on with your life. And then you'll be finally starting work on the wards in the hospital where you're going to be learning skills you're going to use as a physician for the rest of your life. It's also very exciting because all the hard work and hours you spent in a cubicle during the first 2 years of medical school, memorizing all of those drugs, memorizing all of those biochemical reactions, you're finally going to be able to put to use on the wards when you're applying your knowledge to real life patients. And that's something that's very exciting. However, this is also one of the more stressful times of medical school because you're going to be encountering situations that you never expected. So realistically, everyone's clinical rotation experience is going to be very different, and you can't predict what yours is going to be like. And this is stressful and scary because it's the unknown. So even though you can hear anecdotal evidence from colleagues that you may know who are currently in their clinical rotations, it's not necessarily going to best prepare you for what's to come in your rotations. However, I do feel like if you are aware of some of the challenges you might encounter during clinical rotations, you might feel a little better prepared and just a little more equipped to deal with them as you're not being blindsided because you were aware of them ahead of time. So the first challenge I'm going to talk about is that there is no formal curriculum once you get to clinical rotations. And although every school does have either some type of manual or handbook or document with guidelines and objectives of what you should be obtaining from every rotation, you won't always have as much exposure to some objectives as others. So your institutions are going to be different. Some will have larger cardiology departments, some will have smaller GI departments, some might not have a cath lab, some may have a cath lab. And so your exposures are going to vary based on your institution. So this is going to differ a lot from what you're used to in basic sciences, because in basic sciences, you are used to being told what lectures are going to be on the exam, what chapters of the book are going to be covered on the exam, what lectures to watch, and this isn't the case in clinical rotations. So this can overwhelm a lot of students because the amount of material in clinical medicine is just massive. There are ongoing clinical trials all the time. There are so many specialties. The reason we have specialties is because it's impossible to know all of clinical medicine. Guidelines are constantly changing in every specialty, and this can be very overwhelming and difficult to keep up with, especially when CK is going to test you on the most recent guidelines. So I think the best way to overcome this challenge is just kind of have an idea of what resources you want to use before you even start clinical rotations. So sign up for an online Medit account. There are free videos, and Dr. Williams does a really great job at giving you the high yield information for the shelf exams, and then it also prepares you to answer the questions you're probably going to be pimped on the wards as well. But in terms of books, you can ask your colleagues who are in clinical rotations now, or any mentor that you have, what books they use for the rotation, and you can just start investigating these books a little bit, flip through, see which format you like the best, see which one you think is easiest to read, and just have an idea of what book you're going to use for the rotation if you plan to use a book at all. And then either your school will give you the question bank, you can activate it, or you can purchase the question bank in advance, but a question bank is going to be something else you're going to need for the wards. So after you have your day of orientation at your hospital, you know your schedule, you know your call schedule, and all that fun stuff, you can break up your resources and create your own curriculum. So for example, say you're in medicine and there are cardiology videos and cardiology chapters and cardiology questions you want to get through, and you have 12 weeks to do so. You now know your shelf exam date. You can plan the videos you want to accomplish every day. You can plan the readings you want to accomplish every day and how many questions you want to accomplish every day to make sure that you get through all the material. This will help you stay on track, and knowing that you can accomplish all of it in those 12 weeks will put your mind at ease and probably prevent you from being stressed out. So whether you want to break it up with do your heart failure and arrhythmias chapter on the same day and then watch those videos, or if you want to watch all the videos first and then read all the chapters after to sort of reinforce things, however you want to structure it, but having an idea of what resources you want to use in advance allows you to create a curriculum and a study plan, and it makes the massive amounts of material you need to know on clinical rotations a little bit more manageable. So the second challenge in transitioning from basic sciences to clinical sciences is that you don't have a schedule. Medical students, like myself, get in the routine in basic sciences of scheduling absolutely everything, which is great because it helps with time management. However, you're going to need to be a little bit more flexible with this when you get to the wards, because I always compare it as a science experiment. Basic sciences, you're basically in a lab. Everything is controlled. You have lecture at the same time every day. You have lab the same day every week. You know what hours you're going to be eating dinner. You know how long it's going to take you to get through your material. You know all of this information. It's a very controlled environment. When you get to clinical sciences, this is where it becomes real life science, because it's a very imperfect world. Variables are not controlled for, and if your attending or lecturer has to run to a code at 2 p.m. when you have a lecture, you're either going to be waiting around, or you already waited around and now the lecture is canceled and you may or may not have wasted time. If your attending gets called into an emergency surgery, he's not going to be able to let you know probably in advance if he's going to be able to make the lecture or not, and you may be stuck waiting around until the surgery is over. So you just have to keep in mind that those are things you're also going to be dealing with in the future. In basic sciences, you're on your own time. Like I said, most people tend to schedule absolutely everything. And when you get to clinical sciences, more often than not, you are on someone else's time, not really your own time. So I think the best way to kind of prepare and overcome this challenge is just remember that this is going to be you in the future. You're going to be the one giving lectures and trying to manage 500,000 things and running around like a chicken with your head cut off in the future. That's going to be you one day. Keep that in mind, be forgiving, and just be flexible in terms of your scheduling. The third thing that I think is a challenge in transitioning from basic sciences to clinical sciences is the way that you're going to be learning. So in basic sciences, learning comes from self-study, it comes from lectures, it comes from labs, it comes from discussions in small groups and discussion forums. And on the wards, the main way you're going to be learning is through what's called case-based learning. So sure, you will still have either morning report or academic conference, whatever it's called at your institution. And these are similar to lectures, except most programs will make it interactive. So it's still usually presented in a case-based format, even though it's lecture-like, it's a little more interactive, rather than them lecturing you the entire time. And then also on the rounds, whether they're board rounds, whether they're table rounds, or whether they're bedside rounds, you're also going to be learning in case-based format. So in addition to that, the way you think on the wards is going to be a lot different than the way you think in a cubicle. The first 2 years of medical school really condition you to be able to read a question stem, pick out important details, and solve the problem, but you always have answer choices and you can always use process of elimination. Obviously, process of elimination is something that is common in clinical sciences as well. That's why we do tests. That's why we have differential diagnoses to rule in diseases, rule out diseases, and just see what the underlying issue is. But the difference is that you don't have those answers in front of you to pick from. You have to learn how to think systematically, and you have to learn how to just create those boxes in your head so that you can use them for process of elimination. Coming up with the ideas on your own is a lot different than having only 5 to pick from and ruling out 4 of them on an exam. And this is one reason that learning to present a patient can be difficult for medical students, because when you're getting pimped or you have to come up with the differentials or you have to come up with a plan, all of it is coming from inside of your brain. And I think a large portion of what we learn in medical school is kind of just all floating around in our head. We don't actually have them in any systematic box to just pull them out of. So that's something that as a medical student, you have to become a little bit more efficient at during your clinical years. In terms of overcoming this challenge, I think everyone approaches it a little bit differently. What worked for me was using case files as my book resource for each rotation. So the reason that I like this is because it prepares you with the facts you need for the shelf exam, but it's presenting you the information in a case-based format, which is the same way you're going to be learning on the wards. So I found it as a nice transition from the way I learned in basic sciences to the way I learned in clinical sciences. So I was still able to maintain the whole read a book and retain, but also start learning in a case-based format and come up with my differentials, because in case files books, they usually ask you what the differential diagnoses are, what tests you're going to use, and usually some other question. So again, very similar to how it's going to be presented in morning report or on rounds. I just found this helpful for me, but I think everyone approaches this challenge a little bit differently. And so in my opinion, I saved the fourth and most frustrating challenge in the transition of basic sciences to clinical sciences for last. And so the fourth challenge I'm going to talk about, and the final challenge I'm going to talk about, is that the test answer and the real life answer don't always match. And this is really frustrating because as a third year medical student, you are still required to take shelf exams, so you need to know the test answer. However, you're also trying to learn how to think like a physician. You're trying to learn the art and the practice of medicine. And so like I was saying before, it's frustrating because your UWorld questions are similar to basic science in the fact that they are the controlled laboratory experiment, and your clinical rotation experience is going to be the real life experiment. So everything's controlled for in a question stem. Obviously, on the shelf exam, you aren't really taking into consideration what the insurance is going to pay for, how many times a day the patient has to take the medication, and whether they're going to be compliant. You don't have to take into consideration what the patient can afford. You don't have to take into consideration those things when UWorld is just asking you for the best treatment or the best test or what test should be done next. Whereas in real life, if the best drug for a patient is 3 times a day, but they can only remember to take it 1 time a day, perhaps the medication that's only taken 1 time a day is better for the patient than the one that's taken 3 times a day, because at least they're going to be compliant, which is going to help their disease. Likewise, MRI might be the answer on the test, but sometimes in real life, insurance authorization is required, and sometimes you need an X-ray for the MRI. So a lot of these things are going to be done in real life that aren't going to be done on the exam. And this can be confusing because your memory is going to attach to whatever patient you're helping manage. And that's what you're going to think of when you're presented something similar in a question stem. And so you're going to be like, oh, we did this for the patient, but actually we did that because patient couldn't afford X, Y, or Z. So those are things you have to remember. When you are taking the exam, if you do think of a patient, remember the reason why that medication was chosen or why that test was ordered in the first place. And that's going to help you try and sort these out. In terms of overcoming this challenge, I think the best thing to do as a third year student is to stay focused on UWorld. UWorld is going to give you the right answer for the exam, which is what you should really be focused on as a third year student. Obviously, you do want to be absorbing everything from the boards as much as you can in terms of learning how to practice the art of medicine, but ultimately, you will have plenty of time for that in your entire career. And also that's what residency is for. And a lot of your fourth year is for that as well. So in third year, if it's starting to confuse you, just really focus on your UWorld questions. So that's all I have for today. I hope you found this video helpful and it kind of gave you a better idea of what challenges you're going to be facing when you transition from basic to clinical sciences, and just some little tidbits for overcoming those challenges. I know right now is a particularly stressful time for those transitioning from basic to clinical sciences because step 1 exams are being postponed and rescheduled and canceled. And so I hope that this can at least take some of the stress away and give your mind a little bit of solace, so you don't have to worry about the stresses and the blurry lines and everything that comes with going into clinical rotations, and you can just focus on acing your step 1 exam like I know you're going to. So don't forget to like, don't forget to subscribe, and don't forget to follow me on Instagram.